I recognize the Honourable Leader for the New Democratic Party.
Thank you, Madam Speaker. According to the Health Authorities Act, Nova Scotia Health is required to annually submit a health services business plan to the Minister of Health and Wellness. This includes annual operating expenses, coordination with community health boards, and a public engagement plan, and I'll table that. However, when you check the Nova Scotia Health website, no such plan has been filed since 2021 and the dissolution of the Health Authority Board. Can the Premier explain why under his watch there has been no public plan or budget released from Nova Scotia Health?
I recognize the Honourable Premier.
Thank you, Madam Speaker. And of course, the budget is very public. We've had over, I think, 80 hours of budget debate in this House. It's a very, very public document. I can certainly provide the member with a copy of the budget if the member has missed that part of the process of the House here. But what I would say is those operating plans have been submitted. I can check on the website posting, but there's no question that budgeting and thinking ahead and investing in Nova Scotians, those are the things that this government is focused on.
The Leader of the New Democratic Party on her first supplementary.
It sounds like the Premier may not be aware of what I'm talking about, but according to a Freedom of Information request, Nova Scotia Health was in fact given express permission not to produce this report in fiscal 2022-23. That would be the budget. This was the same year that Nova Scotia Health completed the ill-fated purchase of the Hogan Court Hotel Hospital and awarded a nearly $50 million untendered contract for development of the health app. These purchases were made without proper tendering and without guiding strategy or financial accountability provided by a business plan. Yet another example in a growing list of ways this government is evading transparency in their healthcare spending. Does the Premier not think it's possible to meet our current healthcare challenges in a transparent way?
The Honourable Premier.
Thank you, Madam Speaker, and I completely disagree with the characterization from the member. We know that the NDP is extremely negative on this province, extremely negative on the state of the healthcare. I think that the members have told me during estimates that if the government provided everyone with a unicorn, they'd still probably complain about that, and that's absolutely true. But we are totally committed to fixing healthcare. There are positive signs for sure. I hear that from people working in healthcare. I hear that from patients. There's work to be done, no question about that. But we'll continue to do that work because we're focused on Nova Scotians, not negativity.
The Leader of the Official Opposition on her final supplementary.
I find it strange that the Premier would disagree and call negative a piece of information released through Freedom of Information by the Department of Health. But whatever. Since we last saw a plan, healthcare is so much worse. The number of Nova Scotians on the primary care waitlist has more than doubled under this government. Healthcare professional vacancies are on the rise, increasing 197.6% since 2019-20. The number of nursing vacancies within Nova Scotia Health has surpassed 1,000. Emergency departments are unexpectedly closed more frequently, up 32% since 2021-22. The Premier is trying to assure Nova Scotians that healthcare is being fixed. But why should Nova Scotians believe him when every metric is worse and now we know that there isn't even a plan?
I recognize the Honourable Premier.
Thank you, Madam Speaker. Completely disagree. Certainly completely agree with the
Order. Let's reduce the chirping. We're just beginning for the day, so this is our first warning. Thank you. I recognize the Honourable Premier.
Thank you, Madam Speaker. And of course, the Hogan Court deal is an absolutely good deal for Nova Scotians. I'll double down, triple down, sextuple down on that deal, Madam Speaker. That is a good thing for Nova Scotians, despite the NDP negative spin. And there used to be, a year ago, there was 1,500 nursing vacancies in this province. There's 1,000 now. There's a long way to go for sure. But you know what's helped, Madam Speaker? The Patient Access to Care Act, which I'll remind this House is a good thing. It's helping Nova Scotians. It's doing its job in just 1 year. Incredible progress. And I'll remind this House, the negative NDP, they voted against the Patient Access to Care Act.